Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Cholera. Introduction. Cholera is an infection. It is caused by bacteria. It causes diarrhea. The bacteria are found in water or food that has been made dirty by feces. Feces are more commonly known as poop. Cholera is often mild. It may have no symptoms. It can also be serious. Severe symptoms include diarrhea, vomiting, and cramps in the legs. This program explains cholera and what causes it. It also covers diagnosis and treatment. Cholera. Cholera is an illness that causes diarrhea. The bacteria that cause it are called V. cholerae. They infect the intestine. The bacteria make a powerful toxin in the small intestine. The toxin is called CTX. A toxin is a poison made by cells. CTX causes the deadly effects of the disease. CTX attaches to the intestinal walls and causes the intestines to make large amounts of water. This leads to diarrhea and a quick loss of fluids and salts. About 3 million cases of cholera and 100,000 deaths happen each year around the world. Most of these cases are in developing countries, and most are mild. A mild case may be free of symptoms, while a severe case that is not treated could cause death within hours. Symptoms. Cholera can be a very dangerous illness that can kill in hours. It affects both children and adults. Cholera can also be mild and have no symptoms. About 75% of infected people do not have symptoms. The bacteria are in the feces for 7 to 14 days after infection. They can infect other people during this time. Only 1 in 4 people have symptoms. Most of these people have mild or moderate symptoms. About 20% have severe symptoms like diarrhea. This can lead to dehydration. Dehydration could lead to death if it is not treated. Other symptoms of severe cholera may include dry mucous membranes, skin not returning to its normal shape after being pinched, low blood pressure, muscle cramps, fast heartbeat, restlessness or moodiness, thirst, vomiting. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Cholera can be found in dirty water. Raw shellfish, fruits, and vegetables can also carry it. Cholera bacteria are found in the ocean. They attach to shellfish and other animals found in the water. The bacteria travel with their hosts. This is one of the ways they spread around the world. Diarrhea is the main symptom of cholera. It has a lot of the cholera bacteria in it. It can get into water or food and spread. The bacteria can infect others if they ingest it. Not every person who is infected gets sick, but they can still pass the bacteria in their poop. It takes more than 1 million cholera bacteria to make a person sick. Not enough are usually spread from casual contact to make you sick. An example of casual contact is a handshake. The 4 most common sources of cholera infection are 1. Standing water, such as ponds and wells. 2. Raw or undercooked seafood. 3. Raw, unpeeled fruits and vegetables. 4. Grains. Cholera bacteria can live in water for a long time. Public wells are often the source of large-scale outbreaks. Grains can carry the bacteria if they are grown with infected water. Even cooked grains can carry it. It can grow if left at room temperature for a few hours. Diagnosis. A healthcare provider will start by asking you about your medical history. They will ask what foods you have eaten and if you have traveled recently. This can help the healthcare provider find out if you are at risk for cholera. Your healthcare provider will ask you questions about your health, diet, and travel history. A physical exam will be done. Cholera is confirmed through a fecal sample or rectal swab. Samples will be tested in a lab to see if they contain the V. cholerae bacterium. Treatment. Most infected people do not have symptoms. Some have mild to moderate symptoms. Only a few people infected with it need treatment at a healthcare center. People with severe symptoms should seek treatment quickly. Diarrhea causes you to lose a lot of fluids and salts. This can be dangerous and needs to be treated quickly. Oral rehydration drinks can replace fluids and salts. If a child has diarrhea, parents or caregivers should call a healthcare provider. Diarrhea is very dangerous in babies. It can lead to severe dehydration in just a day or two. A child can die from dehydration in a day. In severe cases of cholera, fluids may be given intravenously. This means directly into a vein. This happens at a healthcare center. Antibiotics are often given to treat bacterial infections. They can make the time you are sick shorter. Make sure you take them as your doctor suggests. The infection can get worse if you stop early. Zinc is a mineral. It may help children with cholera. Talk to a healthcare provider to learn if this treatment is right for your child. Prevention. Cholera is very rare in developed countries. The risk for getting cholera is higher for people who travel outside of the country to places where cholera is found. A vaccine can offer some protection, but it's not 100% effective. Practicing good habits is important for people living in and traveling to areas where cholera is found. The following steps can be taken to prevent infection. Drink and use uncontaminated water. Only drink or use bottled or canned water in beverages. Use clean water to brush your teeth. Use clean kitchenware. Sanitize places where food is prepared with soap and safe water. Wash your hands with soap and safe water after caring for someone with diarrhea, after cleaning your child's bottom, after going to the bathroom, before eating or preparing food, before feeding a child. Scrub your hands with ash or sand if you do not have soap. Rinse with safe water. You can also use an alcohol-based hand gel if you do not have soap or water. Use toilets or bury your feces. Do not poop in any body of water. Use toilets or sanitation systems to dispose of poop. Wash hands with soap and safe water after pooping. Use a solution of 1 part bleach to 9 parts water to clean surfaces. Cook food well to reduce your risk. Avoid raw foods. Eat hot food. Cook shellfish like crabs and crayfish until they are very hot all the way through. Avoid raw fruits and vegetables unless you have washed and peeled the fruit yourself. Wash yourself, your children, diapers, and clothes far away from drinking water.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cholera is an infection. It is caused by bacteria. It causes diarrhea. The bacteria are found in water or food that has been made dirty by feces. Cholera can be a very powerful illness. It can kill in hours and it affects both children and adults. It can also be mild and have no symptoms. The 4 most common sources of cholera infection are 1. Standing water, such as ponds and wells. 2. Raw or undercooked seafood. 3. Raw, unpeeled fruits and vegetables. 4. Grains. Most infected people do not have symptoms. Some have mild to moderate symptoms. Only a few people infected with it need treatment at a healthcare center. People with severe symptoms should seek treatment quickly. You can help prevent cholera by cooking food well, using clean water, and washing your hands often. Thank you for using Explain.